Now, the world is looking in horror as India breaks records in terms of COVID-19 infections and the bodies pile up. So tonight we're looking at the lessons that South Africa should consider from that. Last night, the first doses of the Pfizer COVID-19 vaccine, 350,000, landed in South Africa. It comes after the study involving the Johnson & Johnson vaccine, which also aims to immunise 500,000 healthcare workers, was resumed after it was temporarily suspended over those extremely rare cases of blood clotting. South Africa has ordered 31 million doses of the Johnson & Johnson one-shot vaccine and 30 million doses of Pfizer's two-shot vaccine. Now, that's enough for a combined 46 million people out of 60 million. But most still have to arrive in the country, and there has been a slow start to the vaccine rollout. To discuss, we're joined by Professor Moshabela, who's the Dean of the School of Nursing and Public Health at the University of KwaZulu-Natal. Professor, thank you for being with us. Do you agree that it has, in fact, been a very slow start, often because there have just been no vaccines in the country to give? Do you accept the excuses or explanations that have been put forward for that?
Thank you, Francis. Greetings to you and your viewers. I think that it's indeed really interesting for me to observe that the Pfizer vaccine has actually reached us even before the Johnson & Johnson vaccine that was supposed to come from Aspen and Janssen Pharmaceutical. So I think that it is in itself, a testament to the fact that there will be challenges in the supply chain. If it's not this one issue, it'll be another issue. And in this one here, we are seeing that the lesson here is that it was important that government does not put all its eggs in one basket, and therefore this Pfizer vaccine will really help in the meantime to close the gap, and we should now expect to really start vaccinating at least about 50,000 people a day, given the number of dosages we'll be getting over the course of May from Pfizer. But hopefully the Johnson & Johnson vaccine will also arrive soon to help boost the scale up.
Yeah. All right, so you're mentioning 50,000 a day. I think at one stage the estimate was that we needed to do 200,000 per day if there was any chance of reaching some sort of herd immunity by the end of the year. Can we say that that is now not possible?
Yeah, it's going to be dependent on the vaccine that we're getting. I think that for me, I've kind of stopped looking at the bigger projections that have been made, and I'm sort of trying to take it a little bit more day to day based on the vaccines we have on hand. So with the vaccines we have on hand from Pfizer at the moment, then we can say that it's about 50,000. And for next month, given the fact that we will double that number, we can expect to vaccinate about 100,000. It's just that with Pfizer, then we know that, people have to get 2 doses to complete their vaccination cycle. I do think that once we receive the total number of vaccines, the vaccines from Johnson & Johnson, we can start to make projections again, revise those numbers based on the total doses we have. We know that it's urgent that these vaccines be distributed, be delivered on the vaccination sites, be administered to people, because we also don't want them to expire, as we've seen in other countries where they had to get rid of doses that had expired. So there is a sense of urgency to making sure that we distribute these vaccines. But for me, I really think that let's make our estimates based and moderate our expectations based on the doses we have on hand, rather than the ones that we're still waiting for.
Yeah, sure. Let's be realistic. In light of the fact that the vast majority of South Africans are not vaccinated and won't be anytime soon, how vulnerable do you think we are right now? There are fears, of course, of the third wave. We're looking at what's happening in other parts of the world, but some believe that there may be actually a high level of immunity already. We just don't know.
Yeah, no, indeed. I think that we must accept that in terms of the pending third wave, we are extremely vulnerable as a country. So because of that, I mean, let's look at India, for example. India had vaccinated more than 100 million of their population. We can say that at least 10% of the population had been vaccinated in India. But the scenes that we are seeing, they show that as long as there's still a large proportion of the country, that is a proportion of the population in the country that is vulnerable to COVID-19, you can have a devastating infection. We've seen estimates from the National Institute of Communicable Diseases in South Africa that the third wave might be a little bit better than the second wave, but we don't know for sure. It will depend really largely on behavior and how people are going to engage with the measures that are meant to protect from COVID-19 infections. In this case, really, what's going to determine what happens with the third wave is not so much the vaccines. It will be behavior and prevention measures.
Yeah. Well, Professor, let's look at what we can learn from what's happening in India. I mean, how do you diagnose that situation? India makes vaccines for the world. It has this incredible capacity. Like you said, they'd started. There are claims, though, that people became lax and the politicians were reckless, holding these massive rallies. What do you think happened?
The situation in India, Francis, is very painful. I keep telling people that, I cannot imagine seeing such a situation except when we're looking at cases of war. And even then, it just looks like it's worse than that. The cremation that they're doing in the open is not something that is dignifying and is not acceptable. And I do think that a large part of it requires for us to look at the leadership aspects, but also, to be fair, look at the susceptibility in the population, the type of virus that is transmissible, that is circulating. We've seen a little bit of this in December and January here in South Africa. And you then expect, as we have learned in our second wave, that the measures that can be put to minimize transmission can help to bring control. In South Africa, we managed to also control a highly transmissible variant by putting in place measures, and people cooperated. That's why I keep saying that, we have to commend South Africans for what happened with the second wave. And I really hope that that lesson can help us approach the third wave. What we are seeing in India is something that is very difficult. Again, it's a combination of leadership, of behavior, of measures that are restrictions that are put in place, but also certainly complacency, given that the message was clear that, we've got vaccines and, it's under control. They had an earlier control of the virus, but then that kind of left a large population susceptible. And they've got dense populations in India. So it's not it's a fertile ground for the spread of COVID-19. Yeah. But I think that we need to stand in solidarity with India and support them and really rally around, rally with the world to supporting India. The failure of the healthcare system is very painful, where you're seeing shortages of oxygen, failure to be able to manage those patients. And we've also again seen a little bit of what happens in that situation when we had the problems in the Eastern Cape here in South Africa. I just think that it's really important that we invest more in preventing and minimizing the third wave than really trying to experiment and experience a situation that goes out of control. It becomes a runaway train and there's nothing people could do to stop it. I'm very disturbed by what we are seeing there, and I hope that South Africa can take those lessons seriously.
Yeah, indeed. What a sad situation. Thank you very much for that, Professor Moshabela, the Dean of the School of Nursing and Public Health at the University of KwaZulu-Natal.